Joining us on the Kogo News Live line is Dr. Al Johnson, a doctor of internal medicine who's treated veterans suffering from PTSD. Doctor, from what you have learned or gathered, is Ralph suffering from PTSD, or does he seem to have other psychiatric issues, or both?
Well, I think he has both, and that's what the testimony has shown, and what I believe his diagnosis has been in the past. So there's both issues that are present, and that's what they're trying to decide in court.
Now, here's what's interesting for anybody who is non-military. Ralph was never in combat, and has his defense explained how he was able to get PTSD without actually being in a situation that most would associate with PTSD?
Well, exactly, and I don't know that we know the whole story at this point, because PTSD is a pretty broad diagnosis, and whether there were other psychological issues prior to even being in the military, and then what issues those are. It points out the need to have better assessment, to follow up with the vets, and have better care, so we know what we are dealing with.
Can PTSD trigger someone to commit murder?
Not by the definition of PTSD. It's not defined that way. It is a post-traumatic stress where they have reactions to things that they have experienced, but it may cause anxiety, may cause sleep problems, may cause irritability, but not violent activity.
And Dr. Al Johnson with us on the Kogo News Live line, doctor of internal medicine, and he has treated veterans suffering from PTSD. Here in San Diego, we have a very large veteran population, and, with the VA kind of getting a little bit of a bad rap in its ability to help people who are suffering from PTSD, is it adequately treated for people who are coming out of the military?
Well, apparently not, and that's what a lot of the studies have shown. Is that there needs to be greater attention paid, diagnosis, and follow-up on these individuals. A lot of the problem is the vets that have served, they don't want to be labeled that way, and so they don't seek help when they really need help. And it was apparent in this situation that Mr. Littlefield and Chris Kyle were not really fully aware of all the issues of the person they were trying to help, and unfortunately ended up in a bad situation for everyone.
Well, doctor, it does seem other things may have been at play. During testimony, they had said that Eddie Ray Ralph thought that his coworkers were cannibals, and that there were these hybrid pig people that were after him. So it sounds like there may be some delusions there that probably aren't associated with PTSD.
Yes, exactly. And so it's an unfortunate situation along the way, but it just points out that there needs to be better diagnosis, follow-up, and some treatment for these people. I think Eddie Ray Roth's mom was trying to get him some help, but he didn't get it.
Well, it certainly highlights some of the psychiatric issues that we have, not just with PTSD, but in dealing with psychiatric issues as this trial continues. Thank you, Doctor. We appreciate the time. Dr. Al Johnson, a doctor of internal medicine who has treated veterans suffering from PTSD, and that really is the basis for the defense in this American Sniper trial.